Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Namo Buddhaya, and best wishes to all of us. Welcome to SGTB1 presentation. Today, we are going to talk about our student project with the title Pre-Analytical, Analytical, and Post-Analytical Using Glucometer. Without further ado, let's begin. Next slide.
Hello, thank you for the opportunity. But first, let me introduce myself. My name is Ananda Aulia with the 3 last digits of my student ID number is 015. In this opportunity, I will present about the background of this student project. Point of care testing or POCT is clinical laboratory testing performed close to the patient's care. POCT can be performed outside a conventional laboratory for patient by healthcare professionals, and results will be available within 5 to 10 minutes after taking the specimen. According to the size, POCT devices are classified into small-handled devices and large benchtop devices. Blood glucose meter is one of the small-handled POCT devices. POCT in blood glucose monitoring was first introduced in hospitals in 1986. It used to monitor patients with hypoglycemia or hyperglycemia and help patients with diabetes mellitus to take control of their disease. That's all from me. Thank you.
My name is Arnaz with the last digit number of student ID is 002. Based on the introduction, the problem formulation that the writers will discuss in this student project is as follows. The first one is what is blood glucose, how to measure blood glucose, what is glucometer, what are the types of glucometers, what is evaluated in the quality assessment of glucometer, how to perform glucometer's quality control, how to use glucometer, how to troubleshoot glucometer, what factor affect pre-analytical, analytical, and post-analytical results in glucometer. The purpose of writing this student project is divided into 2 objectives, namely general objectives and specific objectives. The first is general objectives, to explain about blood glucose and how to measure it using a glucometer, including how to solve problems related to the glucometer from pre-analytic to post-analytic. The second is specific objectives, explain the definition of blood glucose and how to measure it, explain the definition of glucometer and its types, mention the quality assessment and quality control of glucometer, explain how to use glucometer and do the troubleshoot, describes the factor affecting pre-analytical, analytical, and post-analytical results when using a glucometer. From the process on building the project, the writer realized that there are several benefits of this student project, which are the authors are expected to add insight about blood glucose and how to measure it using glucometer, including how to solve problems related to the glucometer from pre-analytic to post-analytic. The second is for other authors. It is hoped that this can be reference for further studies regarding more in-depth methods regarding the glucometer, both from pre-analytical to post-analytical perspective, and research about technology to measure blood glucose.
Okay, thank you so much for the opportunity. First of all, let me introduce myself. My name is Rahel Juliana Manuro, with related to my student ID 030. So now I'm going to tell simply about what is blood glucose. So, blood glucose is a sugar in the bloodstream and it will be carried to our cell for making energy in the body. And this sugar comes from the food that we consume. As we know, blood glucose is controlled by 2 pancreatic hormones such as glucagon and insulin that play a part in metabolic homeostasis. That's all from me. Thank you, and next slide.
Hello, I'm Putu with 3 last digit of student ID number is 021. So in this opportunities, I'll explain about the measurement. Glucose can be measured in appropriate clinical settings in various body fluids such as blood, interstitial fluid, urine, cerebrospinal fluid, pleural fluid, and ascites. Due to their accuracy, today's enzymatic methods have replaced all the reduction and condensation methods in blood glucose determination. When analyzing laboratory blood glucose report, it is crucial to consider pre-analytic, analytical, and post-analytical factors such as sample collection, storage, and transportation. Blood glucose testing at remote central hospital laboratories could be more practical and efficient to implement TGC. Due to inevitable time lag between sample collection and availability of glucose results to clinical staff and could be unsafe. However, the POC blood glucose meter was developed for out-of-hospital care of diabetic patients, allowing them to control their blood sugar levels. And nowadays, POC glucometers have become more frequently used in critically ill patients. Blood glucose measurement also can be used as a screening tool for diabetes mellitus. It is also essential to assess unwell patients, especially the young or old. That's all for me. Next slide.
Thank you for the opportunities. First of all, let me introduce myself. My name is Putu Chintya Harum Rahcetag with 3 last digit of student ID is 018. So now I will present about the definition of glucometer. Glucometer is a point of care testing or POCT device that used for controlling or measuring blood glucose level in our body. As other POCT device, glucometer also has many advantages compared to general laboratory examination. There are Number 1, portable, that can use anywhere, such as clinic, home, ambulance, or remote area. Number 2, simple, that can do by ourselves without help from the professional. Then small number of blood sample, that this examination just needs a small drop of capillary blood. And number 4 is quick result. The result of examination just need 10 until 20 seconds to be ready. With all of this advantage, glucometer can help us to do self-monitoring of blood glucose. This is really important for patients with diabetes that must control their blood glucose level to prevent hyperglycemia and avoid complications. Glucometer also useful for other people to detect change in blood glucose level. That's all of my part. Next slide.
Thank you for the opportunity. My name is Sienny Kuswardi and the last 3 digits of my student number is 004. I'm now going to explain the types of glucometers. Generally, it can be divided into 2. Self-monitoring blood glucose or SMBG and continuous glucose monitor or CGM. SMBG measures the capillary blood glucose using a finger pricking method, while CGM calculates the interstitial glucose level through a tiny sensor inserted under the skin. Both SMBG and CGM are considered as invasive blood glucose tests. There are also non-invasive glucometers, which uses optical microwave or electrochemical methods without penetrating the skin. That's all from me. Thank you. Next slide.
Thank you for the opportunity. My name is Krisnaditya Dwi Raharja with 3 last digits of student ID numbers 014. Now I will explain about quality assessment and quality control. The first one is quality assessment. Quality assessment is used to monitor all aspects of an instrument, including pre-analytical, analytical, and post-analytical phases. There are some key factors that must be considered when assessing the quality of glucometer, such as accuracy, precision, interference, ease of use, test strip design, and calibration. Next slide. The second one is quality control, which is part of quality assessment. It is usually performed every 24 hours, each time using a new instrument and new container of test strips, if the glucometer falls, and if there are unexpected results. Next slide. Here are some steps to do quality control. The first one, insert the test strip into glucometer in the right direction. Compare the number code on the glucometer screen and the number code on the test strip container. The code number must be the same. The glucometer is ready to test after the code number disappears from the glucometer screen and a flashing blood drop symbol appears. Put the meter on the flat surface and drip in a control solution. Verify that the control solution is not expired and contaminated. Wait for the results to appear on the screen. Then compare the results on the glucometer screen to the expected range for the control solution provided by the manufacturer. If the results are outside the expected range, repeat the test using a new test strip and control solution. Contact the manufacturer or glucometer distributor for assistance if the results are still outside the expected range. That's all from me. Thank you. Next slide.
First of all, my name is Devaline Ramadhan with 3-digit number 016. I will tell you usage of glucometers. Using glucometers is easy to learn and do. There is 3 steps to use glucometers. First, getting ready. Wash your hands with warm water and soap for at least 5-10 seconds, then rinse and towel dry. Get your supplies, your meter, test strip, lancing device, needle or lancet. Open the lancing device and put a needle in. Take the cap off the hand, do not touch the needle. Put the cover back on the device, set the spring on the device so it is ready to be used to stick you. Get a test strip out the bottle or package. Put the cap back on the bottle. Put a strap in the meter that will turn the meter on. Match the code on your meter screen with the code for your test strip. The code is printed on the test strip bottle or package. If your meter has the code built into the strip, go to the next step. When the test strip symbol flashes on the screen, the meter is ready for a drop of blood. Second, checking your blood sugar. Please pick up the lancing device and put it against the side of your fingers. Push the button on the device to release the needle. You will feel the needle stick. Set the machine down. Squeeze your fingers and at its base to get a significant drop of blood. Based on the type of test strip you use, touch the end of the test strip to the drop of blood and put the blood drop on the test area of the strip. Be sure that the test area on the strip fills with blood. The meter will time the test, and your blood sugar number will show on the screen. Write your blood sugar number in your blood sugar diary. The last, clean up the supplies. Remove the test strip and throw it away in your trash. Remove the needle from the device, throw the needle into the puncture-proof container with a lid, such as an old bleach or detergent bottle. Put your supplies away. Store the needle container away from the children and pets. Rewash your hands with water and soap. Thank you.
Hello, my name is Mahendra with the last 3 digits of my student ID 003. Now, we are going to talk about how to troubleshoot your glucometer. There might be some chances that you may encounter problems when using the glucometer. When this happens, you will need to troubleshoot the glucometer using these 3 questions. First, do you have the right strips? If the meters have changed recently, ensure the use of the proper test strip for your new meter so that the strip have not been exposed to light and are not expired. Second, is the blood amount applied to the test strip sufficient? Various meters need varying volumes of blood to read the blood sugar. Make sure that the testing region on the strip is filled with blood so that the meter can do the test. Third, is the sample site contaminated? There are some chances that the sample site is contaminated, hindering the usage of the glucometer. If that happens, clean and dry the sample site before lancing and sampling. That's all from me. Next slide.
Okay, first of all, let me introduce myself. My name is IG Mahendra with 3 last digit numbers 0 to 8. And now, I will explain about pre-analytical factor affecting the glucometer testing. Pre-analytical factor affecting the result of the testing and happens before the sample was taken and analyzed. From the health worker aspect, we can divide by 2 conditions. First, we can correlate it to the health worker skill in managing and how frequent they use glucometer. Second, how good is the condition of the strip test and glucometer before the testing. And from this slide, we can see on the first condition table, it shows that if somebody frequently uses the glucometer test, the result will be more accurate. On the second condition graph, it shows us the longer the strip test store, the worse the accuracy of the strip. And from a patient aspect, there may be some condition that can be a concern. For example, hypotension can affect to false low result. High hematocrit on the blood can affect false low result. And if the patient is not fasting before the test, there will be false high result. That's all from me. Thank you. Next slide.
Hello everyone, my name is Widhanti Putra with my last 3 digit of student ID number is 022. In this occasion, I would like to describe about analytical factors. Beside the pre-analytical factors, analytical factors can also affect the accuracy of blood glucose measurement when using glucometer. Among 100 false diagnoses, 8 are associated with analytical factors. The analytical factors itself is associated with diagnosis or laboratory tests. The 5 factors, especially test strip, is a major analytical factors that can result in false measurement of blood glucose when using POCT glucometer devices. It was proved that glucometer test strips that become unstable due to improper storage or not manufacturer recommended can cause less accuracy and precision of blood glucose measurement. Inaccuracy in measurement due to analytical factors can also result from quality control that not carried out at the indicated time. A study conducted by Kim et al. In 2023 proved that expired glucometer test strips have generally high error rate. This result indicates that quality control of VLCT devices is necessary for accurate measurement value. So that's all from me, and thank you very much. Next slide.
Hello, my name is Lichana Bianca Kusuma with 3 last digit of student ID is 025. Post-Analytical. Post-analytical factors that can affect the performance of blood glucose monitors are incorrect display of glucose units, failure to upload data to the electronic database, incorrect transmission of data to an electronic database, presentation of a misleading message, or failure to respond appropriately to glucose data. In terms of post-analytical error for glucometer use, documentation or result reporting was the most frequent source of error. Thank you, and next slide.
Hello, back again with me. So the conclusion is as stated in the video. You can take your time to pause the video and read the conclusion. Next slide. We recommend the viewers to follow the latest information so that the viewer can easily understand the purpose, procedure, the result, and factors that affect glucometer usage. Next slide. That's all from our presentation. We are sorry if we have said something wrong or inappropriate. Thank you for listening, and I will close this with Parama Santi. Om Santi 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 Om. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Namo Buddhaya, and best wishes to all of us. Thank you.